Hi, everyone. Thanks so much for tuning in to another episode of the United She Stands podcast. Today, we have our first three-peat guest, Priya Bathija, and we are talking to her about women's healthcare and health policy like we always do, but we're also announcing the launch of her podcast, and we're so excited to have her on and share the topics and the podcast with all of our audience. So, Priya is a sought after speaker and expert on women's health with more than 20 years of experience working with hospitals, tech startups, and public health organizations to make healthcare better for patients and providers alike. She blends strategic insight, practical experience, and a focus on scalable solutions with a deep understanding of the people and businesses healthcare impacts. Women's health has been a consistent through line in Priya's career. In 2022, she founded Nyoo Health, driven by a clear vision of how healthcare can lead change and the urgent need to act. Nyoo Health helps healthcare organizations rethink women's health in realistic, actionable steps that start now, resulting in better care, inspired staff, and healthier outcomes for everyone. And Priya's new podcast is called The Women's Health Playbook. Check it out on all your classic podcast platforms and keep listening to hear more about it.
Priya, welcome to the show.
Yeah, thanks for having me. I'm so excited to be back.
I think you're our first three-peat. I think you're our first three-peat. Is that right, Sarah? Yeah.
So honored.
Yes.
Three-peat.
Yeah. And we're here to talk about something really exciting that's happening in your world. So we're very excited to have you. But of course, always a topic that is relevant in our world is women's health. So we know that you founded Nyoo Health in 2022, and now you just launched your podcast, The Women's Health Playbook. So for our listeners, can you explain what is Nyoo Health and what led you to starting this podcast specifically?
Yeah, so Nyoo Health is my strategic advisory or consulting company, and we provide support to healthcare organizations that are looking to rethink, redesign, reimagine how they deliver care to women. So that has been a passion project for me to build that and further explore like how I can engage in healthcare using the skills I have as a lawyer, a policy wonk, a strategist and operator within healthcare. And it's been fun, but it hasn't felt to me like it has been enough, because while Nyoo Health allows me to change how care is delivered to women, I don't actually get to touch women in the sense that I am giving them the knowledge that they need to help navigate this really convoluted and complex system. And so I've been searching for the last 5 years for a way to do that, and to do it in a way that uses my skills and fills gaps. Like, I didn't want to reproduce the good work that other people in the women's health space are doing. I wanted to give women something new and something fresh, but also something that made sense. And we started just like Googling questions that women ask about their healthcare to figure out what's the right topic to cover on this podcast. And as you can imagine, there are a ton of questions that women are Googling about their health. But some that came to the top were, how do I find a doctor? What do I do if my doctor doesn't listen to me? So we decided to create a playbook on the doctor's visit, and that's the first season. And there's so many more questions that women are asking about their health on Google or in AI. And we're going to use those for future seasons. So that's how the Women's Health Playbook came about, and sort of how it connects to my existing work, but takes it one step further with real women and giving them actionable tools and strategies.
I love that strategy of, determining what people are actually asking and answering their questions in a very short, I don't think you've mentioned this, but all your episodes are like 20, 25 minutes. So in very comprehensible, digestible pieces that people are already Googling and trying to find easy answers to anyway. So that's really genius, honestly.
Well, thank you. I mean, another aspect that we spent a lot of time thinking about as we were developing it is, how do we make sure that the content we provide is trustworthy? Because there is a lot of misinformation out there now about healthcare. There's a lot of misinformation in the women's health space, because we know women's health is under-researched, underfunded, misunderstood. And it's the perfect place to get bad information, to be quite honest. So all of the experts that we have on as guests are vetted. The things that they're sharing are backed in science, and they are there as trusted experts that can help guide women through it. So it's short, it's brief, it can be trusted. I think it checks a lot of boxes on what's missing in women's health right now.
Yeah, totally. And what's really missing is that rule book. And so you've been describing women's healthcare and specifically US healthcare system as a game with no rule book. So I know you mentioned women's health is underfunded, under-researched, etc. Can you unpack that a little bit and kind of talk more specifics about what makes the US healthcare system so uniquely stacked against women?
Yeah, so healthcare is so complicated, right? And we all know that because we're all consumers of healthcare, and no one's really taught us how to navigate insurance, how to understand healthcare bills or legal forms or prepare for an appointment. Like, has anyone ever given you a checklist that says, this is what you need to bring into your appointment to have a successful conversation about your health with your doctor? Like, these things don't exist. And even going beyond that, no one's teaching us how to build relationships with care teams, right? And I know we're going to talk about outcomes and getting to better outcomes later, but if we don't know how to do some of these things or understand these pieces of healthcare, we can't really advocate for ourselves. We can't really put ourselves in the best position to have good outcomes, to have good experiences. And we all figure it out by trial and error, right? Like, we've all left appointments with questions that we should have asked, but we don't, or we think about later. And it's normal, but because we're all doing it, but it leaves us feeling more anxious, more stressed. And that's where I think we need that playbook to help us navigate and put that information together. So we have the steps, the actions, we have a checklist. After every episode, we have a checklist of what women need to do, and it will allow them to feel empowered and educated and prepared for what comes their way. And Sarah, I just want to touch on, you said, why is this important for women, or why is the healthcare system stacked against women? It's under-researched, underfunded, misunderstood. And as a result of that, it creates a bigger need for women to advocate for themselves. We need to make sure that we are conveying with confidence what's happening in our bodies, the experiences we're having, what's happening in our day-to-day lives, and making sure that all of that comes into a doctor's appointment. Another reason is that women use more healthcare than men. On average, women use 10% more of healthcare resources than men, and that's after you take out maternity care. And then the third point I just make is that women are making 80% of the healthcare decisions. They're making decisions for themselves, their kids, their partners or spouses, their parents in a lot of cases. And so if there's a lot of friction, and if there is a lot of stress and anxiety created by a system that women can't understand, it is multiplied by all of the people that they are making decisions for. So when we make healthcare better and easier for women, we make it better for everyone.
Yeah. I think that's just so important. That's such an important point. I think it's so easy to just think like, oh, women, 50% of the population. It's like, no, this reaches so much wider than that because of the decision maker piece. So I love that you highlighted that. Yeah. Okay, let's talk about something that's very timely for me, because I actually have a primary care appointment in 3 hours from now after this interview. And so I have been listening to the Playbook. I'm halfway through. I plan on listening to episode 4 on my way to my appointment, which I know is a little late. Sorry, Priya. I will be a better steward of my health soon, I promise. But what's one thing that experts on your show have said that women should be doing before a doctor's appointment that most of us really just end up skipping altogether?
Yeah, so I think it's the prep, right? It's the prep before you go into that appointment. I think a lot of us, and I referenced this in one of the episodes, I say we do the Hail Mary pass, right? We show up and we hope we'll remember the symptoms we have, the meds we're taking, our family history, any questions that we have for the doctor. We just kind of put it all to chance and to luck that when we show up in that appointment, we will remember everything. And I get it. Like, we're all busy. Women are doing so much in their jobs, for their families, for themselves. Like, I get it. But doing that preparation can be really powerful. And in episode 2, our guest, Selena Gore, sort of walks through what you need to bring with you. So a list of questions, right, that are prioritized by how you want to get to them in that appointment. And you can use AI, you can use Google, you can use conversations with friends to help generate those questions. you don't have to do it all by yourself, right? There are plenty of tools that you can rely on. You want to bring in a list of the symptoms you're having. You want to have documentation of when they start, when they stop, and most importantly, like how they impact your life differently. Like, how is your life being affected by these symptoms? You want to bring in your list of medications and a list of the supplements you're taking. And you either want to write down sort of exactly what you're taking in the dosage, or just bring the bottles in with you to your appointment. You also want to bring your family history with you, because so much of our current health is dictated by genetics, and that comes from what has happened to our parents, our grandparents, our siblings. The thing I just want to touch on is you want to bring wearable data, right? So we're all wearing Apple Watches, Oura Rings, Fitbits, you name it. Like, we're exploring that territory of wearable healthcare. And what's really important to bring in is not your numbers from any specific day, but if you're seeing trends. So if all of a sudden you go from sleeping 7 hours a night to sleeping 5 hours a night, that's a trend that's worth noting to your doctor. And it's worth noting not only, again, as you do with the symptoms, that this change has happened, but how do you feel after 5 hours of sleep versus how you felt after 7 hours of sleep? All of that information is really important to bring in with you so that they can evaluate you and give you the best advice possible.
Yeah. And I just want to give a plug here, because I listened to episode 2 yesterday and I ended up making a list in my notes app on my phone after listening to that episode. I was like, I should do this. This is really smart, because I do that. I walk in, I'm like, okay, these weird things I've been noticing, or this has been happening, especially like at a primary care when you go once a year, typically, you know what I mean? And so I made a list, and I even, after listening to it, prioritized it, because I was like, oh, I never thought about but that makes so much sense. You prioritize like the things you're going to do in your day. You prioritize the things you do at work. Why wouldn't I walk in and prioritize the way I'm having a conversation about my health?
Yeah. And I don't know if it was Selena or if it was Amanda in the episode on the actual doctor's visit, but one of them said, like, you prepare for it like it's an interview.
Yeah.
Because that's what it is. You get 20 minutes, you get to shoot your shot, right, with your doctor and get as much done as possible. And if you aren't prepared, then it's whatever the doctor wants to cover. Yeah. And you leave without the information that you need for your life.
Yeah. I actually had a doctor's appointment this morning, and I also made a list of my medications, the vitamins and stuff that I take and all of that. And I was prepared, but I also did feel a little rushed in the exam room today, which is a very common feeling and for women at the doctors, and also feeling dismissed. So I'm very proud of myself. At the end of the appointment, I was like, okay, wait, let's recap. Like, here's my understanding. Is this correct? And I was feeling like a difficult patient, but in my head, just listening to all of your episodes, I'm like, no, Sarah, like, this is their job. Like, they've literally spent 10 minutes with you. They can spend 30 more seconds recapping and making sure you understand. So along with that idea, what other tactics have your guests shared for advocating for yourself in a moment when you feel like you're being rushed out of the room or being dismissed or not heard?
Yeah. Well, first of all, I'm very proud of you for doing
Thank
that.
you.
I mean, I think it is in everyone's best interest to have informed patients. And part of being an informed patient is asking questions and getting the information you need so that you can leave and follow the doctor's orders, right? And so I'm proud of you for asking those questions.
Thank you.
You know, our guest in the 4th episode, Amanda Burke, she references bringing in a summary sheet. And that is basically a summary of all the things we just talked about that you want to bring into your appointment. You put the most pressing issues at top. When a doctor may be moving on or may be in a hurry to move to the next step or to the next patient, it's important that you refer back to that summary sheet or your list of things that you brought into the appointment, right? And take a deep breath, right? Breathe in and remember 3 things, right? And these are 3 things that came from both Amanda and Kelly in their separate episodes of the 1st season. Remember that you're an expert on your body and on your lived experiences. Remember that you are paying for this time and you deserve to take up space in the exam room. And then remember that asking questions, and this is to your point, Sarah, is part of being an informed patient. You're not a difficult patient. You want to be an informed patient. So once you do that, take your deep breath, remember those 3 things, go back to your summary sheet and say, let me go back to my list and read what may not have been covered. Or say, I'm still not clear on A, B, C, or D. And don't be afraid to say, I don't feel like I have what I need from you today, right? Don't be afraid to ask those questions. And I say it very easily. I have been in appointments where I've forgotten to ask questions, where I haven't felt comfortable taking that deep breath, going back to the list. So you don't have to be perfect, right? We all struggle with this. We want to be people pleasers. We want our doctors to like us. We are also busy. We want to get out and to the rest of our day, right? But if this happens, it's okay. You're not alone. You can reach back out. You can set up a follow-up appointment, or you can ask questions through the portal, make a phone call, try to get the information you need. I think it's really important that we don't beat ourselves up when we don't do these visits perfectly. It's a work in progress, and it's a relationship in progress, right? So if you're seeing a primary care physician for the first time, it may not go as well, but the second time it goes a little bit better because that doctor's starting to know you, you're starting to know that doctor, and you constantly build on that going forward.
Yeah. I think something that really stuck with me in episode 2, which is like such a silly and simple phrase, but it's that you're responsible for your health.
Yeah.
And it's like, okay, duh. Yeah. Like, of course we know that. But I think it's easy to think, like, I guess when I walk into like a care situation, I'm like, they're in charge, they're responsible. And back to like, they do have a responsibility to serve you, but you're responsible to advocate for yourself, to make sure you're bringing all the necessary information. Like just that piece of it. She said that a few times in that second episode. And that was really like big for me. I was like, okay, I'm doing kind of a bad job, like not to like bash myself, but you're like, okay, that I need to shift that mindset so that I'm the one in charge here, really.
Yes. And the thing is, especially for women, because we oftentimes like put ourselves on the back burner as we're taking care of every other responsibility in our life. If we don't take care of ourselves, no one's going to do it. Right? No one is going to do it for us. So I actually think that's the biggest takeaway in season 1 is that we are accountable for our own health. We are accountable for advocating for ourselves. We know ourselves the best. And if we're not advocating for ourselves, again, no one else is going to be there to do it for us. So yeah, thanks for calling that out. I mean, I think that's one of the biggest takeaways of the first season.
Yeah, I think just the other thing, and then we'll move on to the next question, that I also took out of listening to this. I'm like, I wouldn't be afraid to ask that question for my kid. Like I will ask a million questions in a pediatrician appointment. So why don't
That's a good point.
Yeah, like why don't I do that for me? It's like that to your point, like taking care of the others around you. Like you're not scared to feel dumb or like you're inconveniencing them. Like you want to know the exact answer because it's your kid's life or whatever.
Yeah.
Whichever care you're providing, whoever it's your parents, whoever it is. So why wouldn't you treat your own appointment the same way?
Yeah. And I love that because I think women feel like they're responsible for the health of their children, yet somehow don't feel responsible for their own health. And so much flows from our health because if we aren't healthy, we can't actually take care of our kids and we can't show up at work and we can't juggle all the things that we're doing. And maybe we think we can, and maybe we do work through it all when we're sick, but we're not at our best. And I think we have to remember to be accountable to ourselves and treat us like we treat the people we care for.
Yeah, absolutely. Okay, so overarching here, the real, I think if you had to bubble stuff up to a high level, is like you want to make sure women are having the highest quality care possible, right? And so is there a specific question or phrase that women could like kind of have in their back pocket that experts tell you make a real difference on that like level or quality of care?
I don't think that there's one phrase, but I think Rebecca Bloom, who is our first guest, she talks about how important it is to be a partner with your care team and a partner with your clinician. At one point, she says they are your partner in Project Healing, right? And she gives us a list of questions that can be used to build that partnership. And I think those questions are critical because they set sort of the path to build a relationship that is focused on trust and respect. And as she says, A+ communication, right? So I'll share those questions, right? Which is, what is the best way to reach you, right? Really important to know how you can talk to your doctor after an appointment, ask any questions that you have. What should I be asking you versus what should I ask your team? right? And that's just a question of respect, right? Because you want to respect your doctor's time. You want to make sure the people who are part of that team assigned to answer those questions are the ones that are actually getting those questions. She also suggests what constitutes an emergency for you, right? So getting that understanding of when something needs to be elevated quickly and when something can just be triaged through a nurse or the portal system, right? Fourth is, can I bring an advocate or support person into my appointment with me? I think many of our guests talk about how important it is to have someone with you in these appointments. And you want to know that if you're picking a doctor, that they are comfortable with that. Another is, how do you feel about patients doing their own research? And that can be research on Google, through WebMD, through other hospital websites. It can be through AI, right? How do you feel if I bring in what I find on AI and I want to have a conversation about that? That will tell you a little bit about whether your doctor is on the same page as you. Can I bring in a written list of questions? Should I use the portal for follow-up questions? Again, sort of defining the rules of the road on how you're going to approach the doctor when you need something and making sure that you're going to the right places. So I think those questions create a good framework that will ultimately allow you to build a relationship where you trust each other, both the patient and the clinician and the extended care team, and you can communicate effectively. And that will lead to better quality care.
I just feel like I've had an experience where I had a small procedure, and of course the doctor is like super knowledgeable, but his nurse, in this case it was an athletic trainer, she was like responding to all of my messages on like my chart within like an hour or two, and I know this doctor wouldn't have been able to like, you know, get back to me in that amount of time. So I think that's such a good call out, just utilizing the care team as well, because they often, you know, are with the same doctors or with the same clinicians, like shift over shift. And like they know, like and the guest in that episode, they were like, they know, like they anticipate like how the doctor would respond and things like that. So I think that's a super important call out.
Yeah, and I think sometimes we think questions are really unique or they're really special to us, but they are the same questions that like all other patients have as well. Like they are the FAQ, right? And if you're a frequently asked question, it's really easy for the care team to answer those so that they don't have to take up the time from the doctor, and the doctor can use their time to answer the questions that are more unique or maybe hitting you in a different way than other patients. And so I recommend that you always start sort of with the care team and trust that they will get back to you on the ones they can answer, and they will elevate the ones they can't to your clinician.
Yeah, totally. So I know on one of the times that you were on the podcast, we were talking a bit about medical gaslighting.
Mm-hmm.
So what do your guests recommend when a woman has raised a concern and it's still being ignored or minimized, or they feel like they are being gaslit by their doctor? What are like those actual next steps that they can take?
Yeah, so Dr. Charles C. Celestine covers this in episode 5 of season 1. And she gives 2 pieces of advice. The first is that everyone has a bad day, even doctors, right? They are human and they have very tough jobs and oftentimes are dealing with the emotional load that comes with caring for people and their lives, right? So give it a second chance. If you feel like your doctor didn't listen to you, schedule another appointment, go in with your list, ask the questions, and don't be afraid to say, I don't feel like I got what I needed from the last appointment. Here's what I still want to talk about, right? Give them that second chance to show that they can respond to your questions and that they can be that partner in your care. And if that doesn't work, she very frankly says, find another doctor, right? And if you can find another doctor, that's exactly what you should do. Go back to Rebecca's question, start at the beginning with a new doctor. A lot of times we don't have other doctors available to us. They might not be in network for our health insurance. We may live in an area that only has access to one specialist. Unfortunately, it becomes more challenging in that situation because you can't just find another doctor and start over, right? And that's why it again, and I know we've talked about this throughout this whole conversation, it's so important to start building that relationship with your clinician, right? If all you have is access to one, it's really important that you start building trust from the beginning.
Yeah, that makes
I think
sense.
that makes a lot of sense. I also think, I don't want to like downplay medical gaslighting because I know it's very real, but I will also say I think sometimes, at least times where I felt like brushed off, listening back to your episodes now, I'm like, no, like I probably did a poor job of like pushing or asking or advocating for myself. It was, you know what I mean? Like I think there's a balance there where it's like back to like, it's my job, it's my responsibility to make sure I'm getting that care too. So to your point, partnership, it's a partnership.
Yeah, no, and I feel that way too. I mean, when I started doing this work, I was like, oh, medical gaslighting, it is a real problem, right? But you kind of have to go a couple layers deeper, right? You have to see what's really happening in that 20 minutes that you have together. Maybe it's 15, maybe it's 7, maybe it's 10, right? But that short period of time that you have with the doctor, think about everything that's going on, right? Like they are rushing in from another appointment, knowing that as soon as they leave your room, they're going to another patient's room, right? It's back to back to back to back for them all day long. They also have to do all of their electronic medical records and the documentation that they have to comply with by law. They also, especially in the case of women's health, may not have been trained on everything that you are asking them about. Because if we have a lack of clinical research, we also have a lack of training problem, right? And so a lot of doctors don't necessarily know the answer to all of your questions. And so if you factor those 3 things into your sort of approach to the conversation and you prepare accordingly, medical gaslighting is less likely to happen.
Yeah, it makes absolute sense. Okay, we're going to shift away from the playbook for just a second, just because you've been on the show 2 previous times. And when you have been, we've talked about things like health policy and the issues surrounding women's health with the state of the world and the current state of this administration in the United States. What in this space are you kind of watching most urgently, or what are you paying most attention to that people should be also paying attention to right now?
Yeah, so I think my answer will probably surprise you, but let me start by saying I think the last time I was on, we talked about the election and the future of women's health, depending on the results of the election. And for those of you that listened to that episode, you know that I completely underestimated the challenges that we would face with a Trump administration, right? So the past 18 months have been so heartbreaking in so many ways for women's health, right? There's efforts to gut reproductive rights. There's the cancellation of women's health research. There are funding cuts to programs that impact women, not just in the United States, but across the world. Not to mention this new focus on increasing birth rates and sort of villainizing individuals who choose not to have children. So all of these are things that are happening around us every day, right? And we're absorbing it. But I think what's really important to remember is that there's also good news, right? There are good things happening around us, and we need to focus on those. So on LinkedIn, every Friday, I share good news and I highlight different things that are happening in the women's health space. I call it a hope scroll, so that we can start changing how we look at things. It doesn't actually change all those things that I just listed that are happening, but it reminds us that progress is still happening around us, right? And that we are playing a long game here. And without celebrating those wins and having that hope, we're not going to be able to keep up the fight to get to where we all know we need to and want to be on women's health. So some recent examples, like we've seen a lot of state activity on paid leave, offering menopause benefits to women. We've seen a lot of new research and reports on the best clinical practices to use or how we move forward to get to better outcomes in healthcare settings. We've seen a bipartisan movement on issues like maternal health. We're seeing progress in organizations across the country that are dedicating new resources to programs, research, and other efforts to improve health equity in women's health. So I have been trying to really focus on the change that we are seeing, because policy is always sort of an ebb and flow, right? And you talk about this in a number of episodes of your podcast, but like we get gains and then we have to take a step back. And I think being able to say, okay, we're going to get through this. We have to go through it day by day, but let's also celebrate the things that we're seeing happen that were the result of so many years of advocacy and work by so many people, right? We can't lose sight of the good and assume there's only bad in the world.
Yeah. We totally agree. As much as the world is falling apart, and that is certainly what our podcast is about most of the time, we are both optimists and we try to find literally any silver lining because that is how we get through this mess. So I love your hope scrolls. I feel like 70% of the time I open LinkedIn, one of your posts is like at the top. I'm like, oh, Priya, yay. I know it's going to be good stuff. I love it.
Yeah.
So we're going to start to wrap up here. So we're going to shift back to the Women's Health Playbook.
Mm-hmm.
If a woman listening today could take just one thing from your podcast and put it into practice this week or this afternoon for Ashley or anyone who has a doctor's appointment coming up, what would it be?
Yeah, so I was going to say that you're responsible for your own health, and we did talk about that earlier. I do think it is the biggest takeaway, and you can start on that literally the second after you listen to us talking about it, right? Your doctors and the healthcare system are partners in the journey, but it's your body. You're accountable. Since we did already talk about that, I'll add a second one, which is that you're responsible for educating yourself as well, right? Trusted sources that are backed in science, and always go a layer deeper. There are a lot of words and a lot of actions being thrown around, not just by one political party, but by both political parties, right? And so I think we have a responsibility to go a little deeper when we see things on social media or we hear things from other people in our lives, or we get a WhatsApp message from an uncle or an aunt or someone that says something, right? I think we have a responsibility to go a step further than just taking it in and spreading it, but actually looking at what is the truth? What is the common ground that we can see in this issue, this area, and apply that, right? Like, I think we are so pulled on both sides. There's so much misinformation out there, especially on women's health. We got to go a step lower. So you're accountable for your health and you need to educate yourself and do the research.
Perfect. Love it. Okay. We will link all of it in the show notes that you talk about, but tell people right now if they want to learn more about your company or listen to your show, where can they find you?
Yes. So you can listen to the Women's Health Playbook at womenshealthplaybook.com. We are also on Instagram at Women's Health Playbook, or you can listen wherever you normally listen to podcasts. We are everywhere. For my company, you can go to our website, LinkedIn. Super easy to find. And if you want to hope scroll every Friday, I'm there. Feel free to follow or connect with me.
Yes. And like I said, we'll have all that in the show notes. Priya, I just want to say congratulations. Your show is phenomenal. As people who have been listening to it, seriously, top-notch stuff. And I think it will be so beneficial to so many women. So thank you for all your work you do.
Yeah, no, thank you for listening, for sharing, and for allowing me to talk about it. I'm so excited to have it in the world and to have women listening, learning, and feeling more empowered as they go into a doctor's visit.
Absolutely.
Yeah. Thank you, Priya. Everything you do is amazing. I can't wait until you come back for a fourth time.
Can't wait. Anytime. Happy to join.